Welcome to all. Today we are going to discuss about the gross anatomy of liver in this discussion. I am Dr. Arun Prasad, Assistant Professor of Department of Anatomy. I will go to the topic. Now, first we'll see the functions of the liver. What are the functions of the liver? As you all know that the liver is an organ which secretes the bile. Main function is secretion of bile, and it also synthesizes serum proteins and lipids. It detoxifies endogenous as well as exogenous substances. What are the endogenous substances? Endogenous substance means substances which are produced inside the body. Exogenous substance is the one which are we ingest like drugs. For example, if you take a paracetamol that is metabolized by the liver, a tablet or a drug which is metabolized is called exogenous substance. So that is also a function of the liver, and it produces hemopoietic cells in the fetal life. So in the fetal life, when the baby is inside the womb, the hematopoietic cells or the hemopoietic cells are produced by the liver, like RBCs and WBCs are produced by the liver. So it has a function on the hemopoietic production in the fetal life. Now, where is it located? So we are going to the gross anatomy of the liver. So where is it located? As you all know that abdomen is divided into many compartments, especially 9 compartments. The liver is located in which compartment? You will see that. Now, what is that? We have the right hypochondrium. This region is called hypochondrium. What is hypochondrium? Below the costal cartilage, hypochondrium. It is on the right hypochondrial region. It is all the epigastric region. What is epigastrium? In front of the gastrium. That is epigastrium. Then it can extend to the left hypochondrium also. You can see in this schematic diagram, it is extending to the left hypochondrium also. Now, inferior border. This border is called the inferior border of the liver, which crosses the transpyloric plane at the level of L1. So we have what is transpyloric plane? Between the xiphoid process and umbilicus, if you put an imaginary line on the midline of the xiphoid process and umbilicus, this is called transpyloric plane because it is crossing the pylorus of stomach. It is called transpyloric plane. This inferior border crosses the from left to right at transpyloric plane. That is what you should know about the location of the liver. Right hypochondrium, epigastrium, part of the going to the left hypochondrium also. Now, one question: why newborn liver is larger than adult? Newborn liver is comparatively larger than the adult. Why? The reason is I have mentioned in the function. The newborn liver is having additional function of production of hemopoietic cells. That is why the newborn liver is larger than proportionate wise. We're not talking about the exact size. We are talking about the proportion to the body size and the liver size. The newborn liver is larger when it compared to its body proportion. Okay. The reason is because of the production of hemopoietic cells by the newborn liver. Okay. Now we'll move on to the gross features, especially the shape and size. This is the dissected image of a liver. It's wedge shape with like a 4-shaped pyramid. What does the pyramid has? A pyramid has an apex and a base. Okay, and most of the students will make a mistake and thinking this part is the apex of the liver. It's not the apex. Here is the apex. You can see the apex is pointing towards the left side. Base is pointing towards the right side. So this is the apex of the liver, which is pointing towards the left side of the body, and this is the base of the liver, which is pointing towards the right side of the body. What is the weight of the liver? Liver is a heavy organ, so it is comparatively larger size and shape. So weight is almost in males it is around 1.4 to 1.8 kg. In female it is comparatively less. It is 1.2 to 1.4 kg. At birth it is around 150 gram. Okay, this is the average weight of male, female, and at birth. The newborns it is 150 grams. Now we'll move on to the external features. So what are the surfaces of liver? Okay. Now you can see here. So we have exactly 2 surfaces. Leave this part. So we have 2 surfaces. First is the diaphragmatic surface and second is the visceral surface. So this part, the part of the liver which is below the diaphragm is called the diaphragmatic surface, especially which diaphragm? Right diaphragm. Okay. The part of the liver which is related to the viscera is called the visceral surface. Again, diaphragmatic surface is divided into 4 surfaces: a superior, anterior, right lateral, and posterior. So here you can see in this picture. So this is the superior surface of the diaphragmatic surface, and this is the anterior surface, This is the right lateral surface, and I have not shown here. Behind this structure, that will be the posterior surface. One thing to note in the diaphragmatic surface, there is no demarcation or a border to delineate all these four parts of the diaphragmatic surface. You don't have a border to delineate the parts of the diaphragmatic surface. That is why it is there is no clear-cut demarcation. But we can say based on the location, superior, anterior, posterior, and right lateral. Last part is called the visceral surface. Other is called the inferior surface. This is a dissected image, dissected specimen of a liver shown from the inferior aspect. This part is called the visceral. We can include the caudate lobe also as a part of visceral surface, but mainly this part is included as a concave regions included as a visceral surface. Okay, we see one by one. Okay, now what are the features for a diaphragmatic surface? It is linked to the diaphragm. We have a dome. So what is dome? So when we say the liver, when we say the diaphragm, we have a right dome of diaphragm and a left dome of diaphragm. The diaphragms are like this, no? So in the middle, we have the central tendon. That is where your heart is like. Okay. So this part is the right dome and this part is the left dome. We can find the IVC. What is IVC? Inferior vena cava in the deep sulcus of the diaphragmatic surface. Okay. We'll see that on the posterior aspect later. And we also have some peritoneal ligaments. What is ligament? These are not ligaments like a bones. These are nothing but the peritoneal reflections on the liver are called peritoneal ligaments. We'll see that in the subsequent slide. Next, visceral surface. What are the features? So it is flat. You can see here, this part is very flat and concave in shape. We have a sharp inferior border. This border of the liver is called the sharp inferior border. This is the only border of the liver we can able to see in the gross picture. Okay. Sharp inferior border. What are the other features? You can see in this a soft tissue which is present separately. This is called the gallbladder, and the fossa for the gallbladder is located in the visceral surface. And next point, what is given is the porta hepatis. What is porta hepatis? Everything is there in the words. Okay, porta means a portal for the hepatic. So any structure which is going inside the liver and coming out. What are structures that can go inside the liver? Hepatic artery and portal vein can go inside the liver. Or the structures they are going to supply the liver. Okay. What are the structures which will come out? Bile duct will come because the liver is going to secrete the bile. Bile will come. All the three you can find in the porta hepatis. So in lung, you must have heard about hilum of the lung, where the structures are going inside and coming out. Similarly, the structures which are going inside and coming out are called porta hepatis. We have one more feature called a fissure for ligamentum teres hepatis. This ligament is called what? Ligamentum teres hepatis. The word teres means round. Okay. So it is a round ligament. It is otherwise called the round ligament of liver. This fissure is present in the visceral surface. Okay. What is this ligamentum teres hepatis? It is nothing but the obliterated left umbilical vein. This they can ask in MCQ. What is this ligamentum teres hepatis? It is the obliterated left umbilical vein. This table column show the same points. I think I am not covered about the bad area. We will cover in the latest part of the session. So we have a diaphragmatic surface, especially the bare area of liver. Bare area is the liver which is directly attachment to the diaphragm. Okay. Then groove for inferior vena cava, fissure for ligamentum venosum. In the picture above, we can see here we have a fissure. This is fissure for ligamentum teres hepatis. Above that, we have a fissure for ligamentum venosum. What is ligamentum venosum? This is the structure where we have the obliterated left. Sorry, I'm again. So this structure is nothing but the obliterated ductus venosus. Obliterated ductus venosus in an adult life forms a ligament that is called ligamentum venosum. Okay. We also have attachments of the peritoneal ligaments. We'll see that that ligaments are coronary, right and left triangular, falciform. We'll see in the next part of the session. Okay. On the basal surface, I already told you, fissure for ligamentum teres hepatis, porta hepatis, and fossa for gallbladder. This we have seen in the previous slide. Now we are moving on to a topic called lobes of liver. What are the lobes of liver? You can compare them with lung. What are the lung lobes? We have a right side, we have upper lobe and middle lobe and lower lobe. Left side, we have two lobes. Similarly, we have in the liver, we can divide them into lobes of liver. There are two types of division which are followed usually. There is anatomical division and physiological division. So anatomically, how can we divide the liver? We are nothing but structurally. Whatever you see as a gross feature, we are dividing them into right lobe and left. That is a structural division. But actual functional division is different from the anatomical division. That is called physiological. So in a sense, that true division is physiological division. Anatomically is gross feature, but in a sense, how the liver function, it is basically the physiological division. We'll see both. First, you'll see the anatomical division. Who divides the liver? Okay. In this slide, you can see this picture. You can see here a white color tissue which is present in the liver and is dividing into a right globular structure and a left globular structure. This is called the falciform ligament. This is actually a peritoneal reflection which comes and attached to the anterior surface of the liver and divide the liver into a right lobe and left lobe. Which is lobe is bigger? Obviously, the right lobe is bigger than the left lobe. They say almost 6 times bigger than the left. It is on the anterior surface. The anatomical division is between the right and left lobe by the what ligament? Falciform ligament. Now, just turn the liver to the posterior aspect. We have 4 lobes here. Anatomically, we have 4 lobes. How this division is occurring? We have a head-shaped borders, which is done by this. So, what is the right end of this border? Again, we are talking about the posterior surface. So, this is the groove for IVC. This picture, you can see the inferior vena cava here. So, this is the groove for inferior vena cava. And we have the fossa for gallbladder on the right border. On the left end of this border, we have the fissure for ligamentum venosum and fissure for ligamentum teres hepatis. These two borders are connected in a horizontal way by the porta hepatis. So we have roughly a head-shaped border which divide the lobes into 4. We have the right lobe, a left lobe, caudate lobe, and quadrate lobe. So easy to remember which is caudate above. In the alphabetic order, which is above? C is above, Q is below. Okay. So C comes first. So we have the caudate lobe above and quadrate lobe below. Okay. So that is the anatomical division of lobes on the posterior aspects. How many lobes we have? We have 4 lobes. Anteriorly, we have only 2 lobes by the falciform ligament. Now I'll move on to the physiological. As I say, this is the true division of the based on the function of a liver. It is based on the distribution of porta hepatic structure. What are the porta hepatic structures? Hepatic artery, portal vein, and bile duct. Okay. So they are the structures which are going inside and coming out. So based on the division of the porta hepatic structure, we divide them into how many lobes. Now here also we are dividing into right lobe and left lobe. But only difference is that margin will be different. Okay. So anatomically, we divide based on the falciform ligament. Now we can see here an imaginary plane running from the IVC to the cystic notch. What is cystic notch? Nothing but the gallbladder notch is called the cystic notch. So if you draw an imaginary line connecting the IVC, vena cava, and the gallbladder, that will run like this in the anterior surface. That will divide the liver into a right lobe and left lobe. This is more or less equal to the functional aspect of liver. This plane is otherwise called Cantill's plane. It's called Cantill's plane. So this is on the anterior superior surface. Now, just to go posteriorly again, we are turning the liver back and we are dividing the lobes based on the same plane which runs on the posterior aspect. But one thing you should note here, the Cantill plane is not running straight as it runs in the anterior surface. It is having a curved course on the posterior aspect, then it comes down. It is having a curved aspect and comes down. Here also it is not dividing into 4 lobes. So anatomically only we have 4 lobes, but here we have only 2 lobes. So we have the right lobe and left lobe, that is the Cantill's plane. One thing you should note here, the caudate lobe is equally divided between the right lobe of liver and left lobe because the Cantill's plane runs like this. Here we divide them into right and left. Cantill plane is dividing the caudate lobe into a part into the right lobe and part into the left. Now each lobe, as I said, it is the functionally division, has its own branch of hepatic artery, own branch of hepatic vein, and hepatic duct. Only vein we can say as a branch is the portal vein. All other veins you should say it as tributaries, but here we can use the term branch. So portal vein branch, hepatic artery branch, and bile duct branch. Okay. Now we are moving on to one more division of the liver. It is called hepatic segments. Okay. In lungs, you must have heard about bronchopulmonary segments. Okay. So similar way here, the liver is divided into some segment that is called hepatic segments or Poinards hepatic segments. How many segments we have? We have almost 8 hepatic segments. This is basically the physiological division, not the anatomical division. This is the physiological division. So physiologically, we can divide the liver into right lobe and left lobe. Must be aware of now. So now again we'll somewhat divide. So this is the right lobe. Okay, now right lobe you put a sagittal section. Oh, I'm not saying it should be a coronal section. You divide the liver of the right lobe into a coronal section into an anterior part and a posterior part. Now you are dividing this left lobe into a medial segment and a lateral segment. So right lobe we are dividing into anterior and posterior. Left lobe we are dividing into medial part and a lateral part. Now this is not done yet. We have only 4 segments now. Now you cut everything in a transverse plane. Now how many segments you will get? If you cut the 4 slices into half, so you'll have 8 segments. So totally we have 8 segments of the liver. This is based on the divisions of hepatic veins. We'll see in the subsequent part. Okay, so now we have how many segments? 8 segments. They are termed into 1 to 8. So 4 segments on the right lobe, 4 segments on the left lobe, 4 segments on the right lobe. You can note down in this picture, the hepatic veins are intersegmental. That means between the segments, we have hepatic veins. Okay. Now, these segments are done by a scientist called Poinard. So, it is named after him. It's called Poinard segments. Poinards, how many segments are there? We have 8 hepatic segments. Roman letter 1 to 8. So, 1 to 4 is there on the left lobe and 5 to 8 is there on the right lobe. 1 to 4 is on the left lobe and 5 to 8 is on the right lobe. Now, what is the name of the first lobe? It is the caudate lobe. So, caudate lobe is named as the first lobe and quadrate is the fourth lobe. You can see here, it's forming a pattern here from 1, 2, 3, 4. It is a clockwise rotation. No? So, this is a clockwise rotation from here, 1, which is the caudate lobe, C above, Q below. So, then 2, 3 is there on which part? On the left end of the liver. Then it comes back against to the quadrate lobe, which is there on the lower part. So this is the quadrate lobe which forms the 4 segments. Now again you make a clockwise direction. So this 5 is there on the inferior aspect of the right lobe. Then 6, 7, 8. So we have roughly 8 hepatic segments. What is the clinical importance of these hepatic segments? The hepatic segments can be used as a way for segmental resection of liver. Segmental resection of liver is possible on the hepatic segments. If you want a particular segments to be removed, you can cut off its blood supply and portal vein and while biliary drainage, then you can take out the liver. Now 1 to 4 is supplied by the left branch of hepatic artery, portal vein and left. So this is the left part of the lobes and so they are supplied by the left branch of hepatic artery, portal vein and on the left hepatic duct. 5 to 8 is supplied by the right branch of hepatic artery, portal vein, and right hepatic. Okay. Now, what are the peritoneal reflections? We are coming to the first. We have seen the gross features, then we have seen the lobes, and next we have seen the hepatic segment. Now we have come to the fourth part of this discussion. So, what is the peritoneal reflections or the peritoneal relations for the liver? Now, all the areas of the liver is covered by peritoneum except at few areas. So, almost it is an intraperitoneal organ. So, entirely it is covered by what peritoneum? Visceral peritoneum, except that few regions. How many regions? 5 regions. See one by one. Now, this region is called the bare area of liver. So what is this? This is the bare area. What is bare? Bare means it is not covered. It's naked. So, it's bare because it's not covered by peritoneum. Okay. So this region is called the bare area of liver. And for the groove for anterior vena cava, we have seen again here. So this is the groove for IVC because IVC is there. That part of the liver is not covered by peritoneum. So peritoneum will cover only the IVC part. inside the IVC, we don't have a peritoneal cover. And we have a fissure for the groove for ligamentum minimum that is also not covered by peritoneum. And porta hepatis, the exact region of porta hepatis. Porta hepatis is surrounded by peritoneum, but this region is not covered by peritoneum. And again, the fossa for gallbladder is also not covered by peritoneum. Okay. These are the 5 regions. This region is called the bare area. These 5 regions are not covered by peritoneum. Now, what are peritoneal ligaments? So, peritoneal ligaments are the peritoneal folds that is present on the surface of the ligament. We divide them into a true ligament and a false ligament. How we say it as true ligament and false ligament? Both are peritoneal ligaments only. If the ligament is having some embryological remnant, they are called the true peritoneal ligaments. They don't have any embryological remnant, it's just a reflection of peritoneum, we call them as false ligaments. So how many true ligaments are there? We have 2 ligaments, ligamentum teres hepatis and ligamentum venosum. These are the 2 true ligaments of liver. What are false ligaments? We have 5 false ligaments. Falciform ligament, coronary ligament, right triangular, left triangular, lesser. So these are the 5 false ligaments present on the liver. True ligaments means what? It is having an embryological remnant that is called a true ligament. First, we'll see the false ligaments. False starts with the falci. Okay. So we have a falciform ligament. What is falciform? It is a sickle shape. The falciform means sickle shape. So sickle shaped ligament which is running from the anterior abdominal wall connecting the diaphragm. The diaphragm is above. So diaphragm, anterior abdominal wall, and the liver. Okay. So it is starting from the diaphragm. It is reaching to the anterior abdominal wall. It comes down to the anterior surface of the liver. Okay. Up to which level? Up to the umbilicus level in the anterior abdomen. Okay. So this ligament is called falciform ligament. On the free border of this falciform ligament, we have the round ligament of liver. That is called round ligament of liver, or otherwise called ligamentum teres hepatis. What I told about ligamentum teres hepatis, it is the obturated left umbilical vein. Okay. Now we'll move on to the next part. We have the coronary ligament. Why it's called coronary ligament? Because it is there on the crown or the upper surface of the liver. That's called coronary ligament. We have 2 layers, or we can divide them into an upper coronary ligament and lower. You look at this picture, this is a peritoneal reflection. Now this peritoneal reflection is coming from here onto the undersurface of the diaphragm, then it is reflected back to the superior surface of liver. At this point, this ligament is called the upper coronary ligament or anterior coronary ligament. This point is called what? Upper coronary or anterior coronary. You can see in this picture also. This part is called the upper coronary or anterior coronary ligament. So it is the reflection of the peritoneum from diaphragm to the liver. Diaphragm to liver. There is one more reflection which is coming from the kidney. So we have the kidney here. It is also coming from here and then getting reflected to the liver. So reflection of the peritoneum from kidney to the liver is called, this point is called what? The posterior coronary ligament or lower coronary ligament. Upper and lower, anterior and posterior, both are same. They are the coronary ligaments. Okay. If you trace it onto the right side, so this superior coronary ligament, if you trace it onto the right side, it forms the right triangular ligament. On the left side, if you trace, what happens? So this is the superior coronary and this is the inferior coronary. Okay. It goes all the way to the falciform ligament and lower part is going towards the caudate lobe of the ligament. That is a tracing of superior. So here we have the superior coronary and this part is called the inferior coronary ligament. What are triangular ligaments? Triangular ligaments are actually a continuation of the coronary ligaments. You can see in the same picture, the superior coronary ligaments is coming down, then it becomes inferior. This part where it is almost forming like a triangle is called, or the end of this is called the right triangular ligament. On the left side, we don't have coronary ligaments. Okay, so this entirely, this structure is called the left triangular ligament. So triangular ligament forms the apex of the bare area. This area is called the bare area of birth. Okay, it forms the apex of the bare area. Left triangular ligament, it forms to the left, it forms the pre-margin, and to the right it forms the left part of falciform ligament. So this part is called the left triangular. Lower down, it can extend to the anterior layer of lesser omentum. So this is the lesser omentum. So this is the anterior layer of lesser omentum is formed by the left triangular ligament. What is lesser omentum? So this picture is showed. So this is the stomach. On the lesser curvature of stomach, you have an attachment of the peritoneum that is called lesser omentum. Okay. The peritoneal reflection of the stomach is called omentum. So on the greater curvature, we have greater omentum. Lesser curvature, we have lesser omentum. This is also reflected back to the liver. I've shown the same picture here. You can see this part. Okay. We can say here margins of the fissure for ligamentum venosum, then it is reflected like this. This entire structure is called the lesser omentum. So this is the superior attachment of the lesser omentum. Inferiorly, where it is attached? Inferiorly, it is attached to the what part? To the lesser curvature as lesser omentum. Okay. Again, we will have to see the true ligaments. So what are the true ligaments? Ligamentum. What I told about true ligaments. True ligaments are the ligaments which are present on the having an embryological ligament, embryological remnant. So we have ligamentum teres hepatis, ligamentum venosum. Ligamentum teres hepatis, it is the round ligament of liver. It is having the remnant of obliterated left umbilical vein. Left is left. Okay. So right umbilical vein usually disappears in the fetal life itself. Left is left. So that is the left umbilical vein that get obliterated because umbilicus have no role in the adult life. So it get obliterated once the baby is born. So it forms the left umbilical vein. Sorry, it is the obliterated part of left umbilical vein, that is ligamentum teres hepatis. Then what is ligamentum venosum? It is the remnant of obliterated left ductus venosus. Ductus venosus is also an embryological structure which is connected to the inferior vena cava that get obliterated as ligamentum venosum. These are the two true ligaments of ligament. Okay. Now we have seen the lobes and segments. Then we have seen the peritoneal reflection. Now we are moving on to the surface and we'll see some more points. So here we have the diaphragmatic surface which is related to the diaphragm of the liver. In the first slide itself, we have seen what are the divisions of the diaphragmatic surface. We have anterior division, posterior division, superior and right lateral. We see some more points or what are the structures which are directly in relation to these surfaces. Okay. Now you see in this picture the superior surface. What is superior surface? This is the superior surface. We have the corresponding lung and pleura on either side, pericardium in the center. So again, here we have on the upper part we have the diaphragm. Above the diaphragm, what will be there? Above the right lobe, we have the right lung and its pleura. Above the left lobe, we have the left lung and its pleura. Pericardium or the heart is there in the center. So these are the structures which are above the superior surface of the diaphragmatic surface. Now we are coming to the anterior surface of the diaphragm. This part this is the anterior surface of the diaphragmatic surface. It is related to two structures. First is the xiphoid process. Second is the anterior abdominal wall. Xiphoid process here and anterior abdominal wall will be present. Now we are moving to the right lateral surface. Right lateral surface with diaphragm intervening. See here in this picture, you can see the right lateral. This is the right lateral surface of the liver. It is divided into an upper 1/3, middle 1/3, and lower 1/3. Upper 1/3 is related to the lung and pleura. Right lateral means which lung? Right lung and right pleura. Middle 1/3 is related to the costodiaphragmatic recess. Because you must have heard in the surface anatomy, the lower border of right lung stops in the 8th rib in the mid-axillary line. So up to the 6th and 8th ribs, what will be there? Lung and pleura. Below the 8th rib, what will be there? You can see from 8 to 10, what is this reflection? That is the pleural reflection. This recess is called costodiaphragmatic recess. That is there on the middle 1/3 of the right lateral surface. Below that, what will be there? Below that, what will be there? 10, 11, 12 ribs. 11th and 12th ribs. So it is called the floating ribs. Especially the 10th and 11th rib. 12th rib will not come up to this. 10th and 11th rib in the lower 1/3. On the posterior surface, we have the peritoneal intervening without peritoneal intervening. With peritoneal intervening, we have the abdominal part of esophagus, right suprarenal gland, and inferior vena cava. Okay. So we have seen the relationship of the structures on the anterior surface. We don't need to know about the visceral surface of the liver. This part of the liver is the concave structure, which is called the visceral surface. Okay. We'll see one by one. So first is the inferior surface of the left lobe. What is the left lobe? This part is the right lobe. This is the left lobe. This major chunk or the major impression which is formed by the gastric. The stomach forms an impression on the left lobe of liver, that is called gastric impression. Now, which part of the stomach? Fundus and the body of the stomach makes an impression here, that is called gastric impression. Next point, what is the point? Fissure for ligamentum teres. We have discussed a number of times in the same class. So what is this? Fissure for ligamentum teres hepatis is having the remnant of left umbilical vein. Also, we have the lobe scale. What is C above, Q below? This lobe is called the caudate lobe. This is called the quadrate lobe. We can include the caudate lobe because it is in relation to the lesser sac for the visceral surface. The quadrate lobe is a lobe which is present down below the porta hepatis, or we can say between the fissure for ligamentum teres hepatis and fossa for gallbladder and porta hepatis. They form the margin of the quadrate lobe. Next, what is that? This is the gallbladder fossa. You can see the gallbladder. Below that, the fossa is called GP fossa or the gallbladder fossa. On to the right of this, what is the impression? So we are seeing the impressions on the right lobe of liver, quadrate lobe, gallbladder fossa, then colic impression and renal impression. You can see in this schematic picture, this impression we have seen, gastric impression. We also have pyloric impression and duodenal impression. What are the impressions on the right side? We have quadrate lobe, gallbladder fossa, colic impression. Above the colic impression, we have the duodenal impression and right renal impression. So right kidney is also making an impression on this part. So this is the duodenal impression. This is the kidney. This is for the colic impression. What is colic impression? Right colic flexure. Okay, so we have the ascending colon. It is converting into transverse colon. That flexure is called the right colic flexure that forms an impression. So these are the reflections on the visceral surface of the liver. This we have seen in the previous slide itself, duodenal impression and right kidney impression. Okay. So we have seen the relationship of what are the parts. We have seen the diaphragmatic surface relation and the relations related to the visceral surface. Now we are moving on to the final part of the discussion. So we need to know the arterial supply of the liver. So what is the main supply? Almost 80% of the blood received by the liver is venous blood. What venous blood? Portal venous blood. So it is a part of portal circulation. It is a nutrient-rich blood that comes to the liver by means of this. How portal vein is formed? Portal vein is formed by the combination of splenic vein and SMV, superior mesenteric vein, will join together to form the portal vein. So why liver is receiving 80% from the portal vein? So when we have food, the nutrients are absorbed in the small intestine, okay, and to the some extent into the, so most of them are absorbed in the small intestine. So that content which is coming from the nutrient-rich blood has to be metabolized before it reaches the systemic circulation. So we have the nutrient-rich blood from the small intestine and from the stomach that has to go via the portal vein to the liver, get metabolized, then come back again to the hepatic veins. Okay. So portal vein is not a venous drainage that we should have in mind. It is a portal for the metabolism. It is a portal for metabolism that is called portal circulation. Nutrient-rich blood from the intestine and the gastric mucosa is reaching the liver through the portal vein. Okay. But liver needs some the oxygenated blood for its survival. No? That is given by the 20% by the hepatic artery. Hepatic artery will give the oxygenated blood. It is 20%. So 80% is by portal vein, 20% is by hepatic artery. This heading should be changed to venous drainage. Okay, so what are the venous drainage? Venous drainage is the hepatic veins. In this, I think, whenever we were discussing about the hepatic segments, I told you the 3 hepatic veins. We have the right hepatic vein, middle hepatic vein, and left hepatic vein. So left hepatic veins is between the medial segments and lateral segment. Middle hepatic vein divides them into a physiological right lobe and physiological left. Between the right and left lobe, we have the middle hepatic vein. Right hepatic vein runs between the anterior group and the posterior group of the right. Okay. We have three veins: right hepatic vein, middle hepatic vein, and left hepatic vein. So final part, we can see some ultrasound image. This is how a liver will appear in an ultrasound. You can see this is the hazy appearance, these translucent shadows are the liver parenchyma. And this appearance is called the flying bird appearance. Okay. So flying bird appearance will show the hepatic artery, splenic artery, and celiac trunk. What are branches of celiac trunk? We have left gastric artery, splenic artery, and common hepatic artery. So this is the hepatic artery, splenic artery, and this is the celiac trunk. Left gastric artery is not seen because it's related to the stomach. So you can see the two branches of the celiac trunk. The appearance is called flying bird appearance. Okay. Now, one funny appearance, it's called Mickey Mouse appearance. Okay. So this demonstrates the structures on the porta hepatis. We have the hepatic artery on the right side, common bile duct on the left side. Okay. Ideally, it should be the artery, bile duct is on the right side, sorry, hepatic artery is on the left side. And portal vein is usually on the posterior aspect. This gives an appearance of a Mickey Mouse. That's what's called Mickey Mouse appearance of the structures in the porta hepatis. More funny sign, bunny sign. Okay. What is this bunny sign? It is the sign which shows the hepatic veins in an ultrasound image. So we have the middle hepatic vein, the left hepatic vein, and the right hepatic vein. Gives an appearance like a bunny of a photo. So middle hepatic vein runs between the right and left lobe. This acts like a landmark for the sonologist to determine the hepatic veins diameter and function. Okay. We have some condition. We have the dilated hepatic veins, Kochari syndrome. So we have the dilated hepatic veins. So we can able to find out the diameter by means of this finding the middle hepatic. Now, final part. What are the factors that keeps the liver in position? And why? What are the factors? Why we are saying talking about this part? So in the first slide, I told you what is the weight of the liver? 1.4 to 1.8 kg. You can imagine 1.4 to 1.8 kg structure is lying on the right of the bone. Why it's not falling down? Now, why it is kept in this question? Because lower down we have the abdominal cavity. There is a possibility of falling down? No, what is the keeping it? So main factors is the hepatic veins draining into the iris. We have the hepatic vein, which is the right hepatic vein, middle hepatic vein, left hepatic vein. They act like an anchoring channel to keep the liver attached to the IVC. IVC is already attached on the right side. So the liver is almost attached to the IVC by this. So main factor to keep the liver in position is the hepatic veins draining into the IVC. The second part is the intra-abdominal pressure. We have a positive intra-abdominal pressure created with the tone of abdominal muscles. That is also keeping the liver in position. Last part is the peritoneal ligaments. Most of the students will make a mistake that the peritoneal ligaments are keeping. They are actually the secondary support for the liver. The main support is the hepatic veins. So that forms the liver. Now supply most of the abdominal organs or visceral organs are supplied by the autonomic nerve system. We have the sympathetic plexus and parasympathetic plexus. Sympathetic is by the celiac plexus, parasympathetic is by the hepatic branch of vagus, anterior vagus. The sympathetic is thoracolumbar outflow, parasympathetic is craniosacral. Okay. Inflammatory pain of the hepatitis. If you have an inflammation of the liver, that is called hepatitis, they are gone or they are carried through the sympathetic fibers, especially from the epigastric region and the shoulder. Lymphatic drainage, at last, it's essential to know about lymphatic drainage in the case of carcinoma of the liver. Superficial lymphatics will come from the anterior aspect of the hepatic nodes, then it is carried to the celiac. Usually, the lymph nodes will tend to accumulate near the major blood vessels like celiac trunk and the hepatic artery. They are called hepatic nodes and celiac nodes. From the posterior surface of the liver, the superficial lymphatics will go to the posterior mediastinal lymph nodes. When we have the lymphatic drainage from the deeper part of the liver, we can divide them into an ascending trunk and a descending trunk. Ascending trunk will reach to the IVC nodes, inferior vena cava lymph nodes. Descending trunk will go to the hepatic nodes. Ultimately, all the nodes will reach to the celiac nodes. To summarize what we have seen till now, we have seen the first part, we have seen the gross features of the liver, shape and the location. Then next part, we have seen the surfaces, especially the diaphragmatic surface and visceral surface. Only one border is there, that is the inferior border. The next part, we saw the what are the lobes. How many lobes are there? Anatomically, two lobes on the anterior aspect, four lobes on the posterior aspect. Physiologically, two lobe anterior, two lobes posterior. What is the plane? Candle's plane. Next part, we saw the segments. How many segments are there? We have 8 hepatic segments. So left side we have 1 to 4 segments. 5, 6, 7, 8 is there on the right. They are called coinod hepatic segments. Next part, we saw the relation on the diaphragmatic surface, visceral surface, and what are structures which is related to the liver. Last part, we saw the arterial supply, total vein 80%, 20% is the hepatic artery. Venous drainage by the hepatic veins, 3 hepatic veins are there. Then we saw the lymphatic drainage. Okay. Thank you for the session. Have a nice day.